Hello everyone, I am Dr. Avinash, periodontist and associate professor in the Department of Periodontology, JSS Dental College and Hospital, Mysore. In this video, let's understand the differences between normal gingiva and gingivitis. Let's start with the color of the gingiva. The normal gingiva is pale pink with variations depending on complexion and melanin pigmentation. Whereas in gingivitis, the gingiva becomes reddish, bluish red or deepened color due to increased vascularity and inflammation. So as we see in the picture, we see the normal gingiva is pale pink in color. The factors which are responsible for this color is degree of keratinization, vascularity, and also to some extent the melanin pigmentation. Whereas in gingivitis, there will be increased blood supply and also there will be thinning of the epithelium so that it appears more red, and also it may appear bluish red in chronic condition because of venous stasis. Consistency of the gingiva: in normal gingiva it will be firm and resilient because it is tightly bound to the underlying bone, and also there is no edema, that's why it will be more resilient. Whereas in gingivitis, the gingiva appears soft, edematous, spongy, and loss of firmness due to the edema. Here we have fluid collection, that is why the gingiva becomes soft. The normal contour of the gingiva will be scalloped and the marginal gingiva will be knife-edged. The interdental papilla will be pointed and it is closely adapted to the tooth surface. Whereas in gingivitis, the marginal gingiva becomes rounded, rolled, and the interdental papilla becomes blunt, and in severe cases, the scalloping may be lost. When we say size of the gingiva, it is the sum total of all the cellular and extracellular components of the gingiva, including the vasculature and the bulk of the fibers which is present in the connective tissue. In gingivitis, the gingiva may be enlarged due to edema or even fibrosis in chronic inflammation. Position of the gingiva. In normal condition, that is in healthy gingiva, gingival margin is at CEJ or slightly coronal to CEJ. Let's say it is about 2 mm coronal to the CEJ. Whereas in gingivitis, there will not be apical migration, but the margin of the gingiva may be more coronal due to the edema and swelling, and we may even see pseudo pockets in such condition. Bleeding on probing. Normal gingiva, it is absent, there is no bleeding on probing, and also in mild gingivitis there may be absence of bleeding. Whereas in moderate gingivitis and severe gingivitis, there will be bleeding on probing present due to ulcerated epithelium of the ulcerated circular epithelium. As we see in this picture, we can appreciate there is break in the circular epithelium and the connective tissue is exposed, and when we probe the gingival sulcus, it will bleed. Surface texture. Normal gingiva, it is stippled, that is it appears like an orange peel as we see in the picture above here, and the reason for stippling to appear is because of the longer rete ridges which are present. Whereas in gingivitis, there is loss of stippling and the surface appears smooth and shiny. Here the longer rete ridges are lost because of even the loss of the collagen fibers or destruction of the collagen fibers in the connective tissue. And also because of edema, there is swelling which makes the gingiva appear smooth and shiny. Exudation. In normal gingiva, exudation is absent, whereas in inflamed gingiva, exudation may be present as there is increased flow of the GCF, and also there is lot of interaction between the inflammatory cells which are present in the GCF and the microorganisms which are present in the gingival sulcus. These interaction may lead to a formation of exudation because of the dead cells as well as dead microorganisms and their products. Finally, abscess. In normal gingiva, abscess is absent, whereas in gingivitis, occasionally it may present. It's not that all the gingivitis cases would have abscess, but in case if there is abscess in gingivitis, it is due to secondary infection and it is confined only to marginal gingiva or interdental papilla. If it involves attached gingiva, that means there is attachment loss, and then we consider that as periodontal abscess. The other abscesses which we may see in the oral cavity are the periodontal abscesses, pericoronal abscess, and also periapical abscess. Thank you for watching. I hope this video was helpful. Please like, share and subscribe to the channel for more such videos. Also, if you have any questions, please post it in the comment section. I'll be glad to answer.